Welcome to our presentation on the digital doctor and AI healthcare. Healthcare technology, or health tech, is aimed at 1. Boosting medical, hospital, and administrative productivity, 2. Giving new insights into medical diagnoses and treatments, and 3. Improving the patient's quality of care in a cost-effective way. Healthcare technology, or health tech, is an all-encompassing term. It includes e-health, m-health, telehealth, EHR, and information technology. IT tools and devices to provide clinicians with real-time, data-driven choices. A recent survey by MIT Technology Review Insights in association with GE Healthcare found that 75% of healthcare facilities have used AI in medical care. In 2016, the Hong Kong-based Hanson Robotics introduced Sophia. In 2021, Hanson Robotics unveiled Grace, who is a humanoid robot designed as an assistant for doctors. Grace is equipped with sensors, including a thermal camera to detect a patient's temperature and pulse. It is a companion for patients specializing in senior care and speaks 3 languages: English, Mandarin, and Cantonese. It can socialize and conduct talk therapy. Mobile health, or m-health, means medical practice that is supported by mobile devices, such as smartphones, to enhance point-of-service data collection, care delivery, and patient communication. The m-health mobile apps utilize artificial intelligence, AI, to provide services such as telemedicine. mem-health, or mobile health, has transformed telemedicine. Sensors, computers, the internet, and various communicating systems, such as smartphones, have propelled telemedicine as a truly equal option as in-person visits for patients in rural and urban areas. In 2021, several states have introduced legislation to give permanent status to temporary telehealth-related regulations post-COVID-19. For example, in January 2021, the governor of Arizona proposed legislation to permanently allow Arizona residents to receive telehealth services from any healthcare practitioner who is licensed in one of the 50 states or the District of Columbia. Digital health includes mobile health, m-health, health information technology, IT, wearable devices, telehealth, telemedicine, and personalized medicine. Digital health technologies use computing platforms, connectivity, algorithms, and sensors for medical care. The Internet of Things, IoT, and the Internet of Medical Things, IoMT, contains various devices and mobile apps that utilize the internet and play a critical role in tracking and preventing illnesses. They include wearables and sensors that track patients' conditions by monitoring body or organ functions, such as temperature, glucose level, blood pressure, and other vital signs. In 2017, the FDA approved the first smart digital ingestible pill with a sensor which can be tracked online. The sensor transmits data to a patch that sends the information to a smartphone app. Similarly, the pill cam can record and transmit videos of the intestinal tract. From 1995 until December 2021, the FDA approved numerous AI-based medical devices or algorithms. In 2020, about 30% of the market share for IoT devices came from healthcare. WebRTC stands for Real-Time Connections on the Web. This technology allows medical applications to provide remote health services. It is an open-source API, application programmable interface-based system, which connects web browsers with mobile applications. It ensures that other systems can interface and access data in a unified and secure way. Artificial intelligence, AI, denotes the ability of machines to imitate human intelligence. It has many healthcare applications. AI machines focus on performing cognitive skills similar to humans. They are capable of learning, thinking, working, functioning, reasoning, self-correction, and solving problems. Machine learning and deep learning are subsets of AI and will be discussed shortly. There are different types of AI with 3 main categories. 1. Artificial narrow intelligence, or weak AI, are usually designed and trained to complete one specific task intelligently. They simulate human behavior based on a set of parameters and input data. Examples include chatbots, voice assistants like Siri, Alexa, and Cortana, facial recognition systems, and AI systems that search the internet. Number 2, artificial general intelligence, AGI, or strong AI, are systems that would perform on par with humans. They are able to interpret and understand human tone and emotions and act accordingly. 3. Artificial superintelligence, ASI or super AI, which describes a machine that would become self-aware and surpass humans' intelligence and ability. These superintelligent machines have raised some ethical concerns. Physicians commonly utilize experience or rule-based guidelines to evaluate patients. They are restricted to certain patient features, symptoms, and signs. In contrast, AI uses evidence or probability-based data for patient evaluation and treatment. The clinical decisions of AI are based on a much more complex feature set, including the massive amount of data coming out of the genomic, proteomic, metabolic, and other omics fields. The use of AI machine-based diagnostics or treatment recommendations would require a shift in physician thinking from experience or rule-based guidelines to evidence or probability-based data. Machine learning, ML, incorporates intelligence into machines that automatically learn from data that is inputted. ML systems accomplish different types of tasks, such as classification, regression, or clustering. They learn from data through training and then apply learning to make informed decisions. Examples include workflow, coding, diagnosis and treatment recommendations, malware detection, weather forecasting, Netflix and Amazon Prime recommendations for movies, among many others. ML requires some human intervention and guidance. The accuracy of ML algorithms increases when more data are inputted. The data provided is structured, pre-processed data. Its algorithms work well with a reasonable amount of data. They do not perform very well when the volume and complexity of data increase multifold. Tiny ML are microcontrollers that can shrink deep learning networks to be embedded into any small hardware system, thereby enabling high-powered AI, IoT devices to perform efficiently. Once they are trained, the microcontrollers distill, quantify, encode, and compile data. Quantum ML is a hybrid of quantum computing mixed with machine learning. This technology facilitates understanding nanoparticles and advanced researches efficiently. AutoML uses simple, secure, and flexible templates, which simplifies the job of data scientists working on machine learning projects. MLOps is described as the intersection of ML, DevOps, and data engineering. It focuses on infrastructure, reliability, and efficiency. It automates data management on larger scales easier and ensures minimum human errors. Full-stack deep learning helps bridge the gap from training machine learning models to deploying AI systems in the real world. Deep learning DL is also a subset of AI. It mimics the working of the human brain. It is based on artificial neural network, ANN, convolutional neural network, CNN, and recurrent neural network, RNN. These represent virtual nervous system, VNS, models with artificial or virtual neurons as the functional algorithms. The algorithms are used to solve intricate problems. DL is capable of making decisions. To accomplish their tasks, DL systems require an enormous amount of raw data or big data to learn and make informed decisions. The ML model is unable to do this. The data may be structured or unstructured, as compared with ML, which requires structured or pre-processed data. The DL model learns from both new unstructured data or prearranged structured data and from previous experience. It corrects itself progressively. It is capable of solving problems without explicit programming complex tasks. It trains and learns to extract features on its own without manual feature extraction. In contrast, ML algorithms cannot do that. Examples of DL models include robotic surgeries, virtual assistants like Alexa, Siri, and Google Assistant, speech recognition systems, computer vision, and the first humanoid, Sophia and her sister Grace, who is a humanoid nurse. What is a black box AI? An inherently black box is one where the developer cannot share the details of how the algorithm works in practice. In contrast, ML algorithms that are deliberately black box are known to their developers, but they will not share the details of how the algorithm works. Let us turn now to imagery and look at the spectrum of visual reality from RR, VR, MR, and ER. Real reality RR is what the human eyes see or what is captured, e.g. by a smartphone camera, unaltered by artificial means. Virtual reality VR is totally computer-generated imagery of any kind, such as Google Glass, smartphones, Nokia's City Lens, Pokemon Go, or Snapchat. VR requires headsets to create an illusion of 3D viewing. In fact, users stare at a fixed-distance 2D display, and that may cause nausea, eye strain, and feeling sick. VR is technology that shuts the user away from RR. It is used extensively in all aspects of healthcare. For example, stroke victims may use VR to overcome motor deficiencies. Augmented reality AR provides information in 3D space. It supplements real reality AR with computer-generated imagery of any kind, such as Google Glass and smartphones. In medicine, combined virtual and augmented reality is used extensively, as noted on this slide, from classification, cell biology, medical education, to assisting the surgeon's vision in robotic surgeries by providing information about their procedures. Medical and nursing students can learn more about procedures through AR overlays. Mixed reality MR is similar to AR, but it places images and text on top of real reality to create an environment in which the user will treat the objects as if they are really there. It is a hybrid reality. Extended reality XR is a new emerging trend aimed at defining any content using emerging technologies. It includes all real and virtual combined environments and human-machine interactions generated by computer technology and wearables. There is a virtual reality VR sociable network. VTime XR allows users to meet, chat, and share with people around the world. A cross-reality XR social experience through augmented reality AR. Remote medical education is a major aspect of XR. Using XR, doctors and medical students will be able to practice surgery on virtual patients and view body organs in 3D. They may use robotic arms to perform a surgery using accurate small incisions, thereby diminishing blood loss and expediting recovery. Here is an example of the use of extended reality to obtain medical information in a modern operating room. Immersive technologies are transforming the quality and availability of training and communication across the healthcare industry. It mixes virtual content with environment, making it a new blended reality with which people such as doctors, patients, and nurses are able to engage naturally. Holography was developed in the mid-1900s. At first, holograms were recorded optically. Later, supercomputers and headgears had to be used to generate 3D imagery. In 2021, MIT used a deep learning algorithm called convolutional neural network to accelerate computer-generated holography. This allows for real-time 3D hologram generation and transmission via the internet using a laptop computer and can be visualized on new smartphones. Combined AR technology with holograms is useful in medical education, teaching human anatomy courses in medical schools in clinical care and telemedicine. For example, AR technology using the HoloLens was useful for autopsy, gross and microscopic examination, and ideally suited for digital pathology. Natural language processing, NLP. NLP is a specialized branch of AI that allows computers to understand human structured and unstructured written or spoken data, such as medical records. NLP includes speech recognition, text analysis, translation, and other goals related to language. It accelerates review of medical records and minimizes need for manual review. It can access vast libraries of coding rules and classifications, and can minimize coding errors. Chatbots are used extensively in healthcare to 1. Replace or augment healthcare workers to collect medical information, for example, symptom checkers. 2. Provide reminders and motivational messages. 3. Provide a sense of security when a doctor cannot immediately be reached. For example, telemedicine consists largely of communication tools, which allow patients to connect with doctors. There are many health chatbots, and 10 examples are listed on this slide, with links to their websites. What does a virtual medical office assistant do? The virtual assistant can handle just about any task that doesn't require specific healthcare expertise, such as administrative tasks, medical scribe and prescription, virtual receptionist, insurance tasks, bookkeeping, and marketing. Whatever your medical specialty is, if you feel that you have too much on your plate, or your team is struggling to meet deadlines, you should consider using a medical virtual assistant. The benefits of a virtual medical assistant include save money, no need for office space, spend more time with patients, provide a better service, free up time for other activities, and greater flexibility. AI has rapidly entered EHRs and EMRs, and the major companies include Epic Systems Corporation, NextGen McKesson Corporation, Meditech, Allscripts, and Cerner. EHRs and EMRs are essentially similar, but technically they have superficial differences. EMRs are suitable for healthcare providers in specialty clinics, regardless of size. EHRs are suitable for larger organizations at multi-locations. In a 2020 survey of National Electronic Health Records, 89% of physicians reported using an EHR or EMR system. But physicians hate EHRs and EMRs. Only 10% of physicians say they would leave their current EHR system as it is. Why? Because EHRs and EMRs have confronted implementation hurdles. 1. High cost. 2. Underdeveloped UX utilization experience. And 3. Documentation issues. The combination of poor UX user experience by clinicians and the expectation of excessive documentation has contributed to physician overwork, stress, and burnout. Artificial intelligence is helping improve EHRs through 1. Natural language processing. 2. Knowledge representation, which allows the AI machine to store what it knows or hears. 3. Automated reasoning, which allows AI to use the stored information to answer questions and to draw new conclusions. 4. Machine learning. 5. Deep learning. 6. Computer vision. And 7. Robotics allows the manipulation of objects and moving about. Other health technologies include clinical decision support, CDS, blockchain, and others. Blockchain technology is more popular for its role in cryptocurrency. In healthcare, blockchain uses cryptography to secure EHR data and makes it available only to those with access to it. For example, blockchain can validate clinical trial and claims results, track medicine distribution, authenticate prescriptions, and prevent insurance fraud. Several EHRs have incorporated it to ensure security, scalability, and confidentiality. An example of an EHR and artificial intelligence AI is the IBM's Watson project. The Watson Innovation Center helps analyze medical records for rare illnesses. In doing so, the system captures 200 million pages of text in 3 seconds. Apple, Google, and Amazon have all entered the healthcare space, and their presence will pressure EHR vendors to innovate. The top technology innovations that are being worked on to support EHR optimization include 1. Improvement in accessibility of EHRs. 2. Interoperability with other EHR systems. 3. Searchability and ease of use. 4. Standardization of EHRs. And 5. Optimization of patient-centric engagement throughout the scheduling and treatment process. There are ethical and concerns about making diagnostic and treatment decisions via AI. If a patient is injured due to an AI machine, the provider or manufacturer may be liable. Doctors and patients prefer the personal touch that is provided by in-person doctor visits. There are privacy and liability issues that arise when machines and computers are contributing to or replacing healthcare decisions. Other ethical issues include lack of internet access and lack of transparency. The impact of AI on telemedicine has been substantial. In 2020, during the COVID-19 pandemic, the CMS opened up telemedicine as a truly equal option for all patients. Consequently, telemedicine has helped patients in rural and urban areas find medical doctors and specialists to care for their specific disorder, thereby increasing access to healthcare in a cost-effective manner. The COVID-19 pandemic has forced various fields of medicine and surgery to adapt quickly and has hastened the implementation of telemedicine. In 2021, Barboza and co-authors reported that telemedicine has improved access to care, improved health outcomes in select circumstances, and has addressed geographical, but less so social barriers. Thank you for listening.